Who do you trust more, a corporate executive or a politician? In most countries, every citizen has health coverage. They're either covered by the government or a private insurance company. Americans aren't all covered, so we have to buy health insurance, which typically only covers some of our medical bills. We pay the rest on our own. The difference between our system and others comes down to management. In most countries, the government manages the healthcare system. The US healthcare system is managed by for-profit insurance companies, and being managed by top corporate talent in America comes at a price.
We spend over $4 trillion in the United States each year on health care. My name is Thomas Rice. Most recently, I've been studying comparative health systems. In other words, how the United States compares to other high-income countries.
You might not feel like a high-income person, but you're living in a high-income country. In a 2019 study by the Commonwealth Fund, the US ranked first in healthcare spending, dropping 16.9% of our total GDP on medical bills.
It's a large chunk of the entire world spending on healthcare. It's probably around 40%. But if you look at it per person, we spend about $12,500 per person per year on healthcare, which is about double of what other wealthy countries are spending.
That breaks down to about 1 cent every 30 seconds spent on medical bills. And unfortunately, all that spending doesn't result in us living longer.
There's one measure called Mortality amenable to healthcare. And basically, it looks at how many people in the population are dying for causes they shouldn't be dying for if the healthcare system is doing a good job. And what we see is that the United States is among the worst of the OECD countries in keeping people alive from things that they shouldn't be dying from. People shouldn't be dying from sepsis. They shouldn't be dying from infections. There's a lot of heart diseases they shouldn't be dying from, a lot of cancers that they shouldn't be dying from. There are many things that we shouldn't be dying from, but people are dying from them, often because they don't have access to the care that's available out there.
So we spend twice as much, live shorter lives, and die sometimes unnecessarily from treatable complications. Seems like healthcare isn't the industry's top priority.
What's happening is that we're not getting more care. It's because our prices are so much higher. I think Americans are paying too much for health care. And I think the reason we're paying too much for health care is that we don't have a unified system that can work together to try to lower the prices that we have. In other countries, there might be a single payer, but there might also be many insurers. But the insurers are coordinated. For example, in Germany, there are over 100 insurers. Their prices are much lower than ours. All the insurers pay the same amount.
Insurance companies negotiate prices with the medical industry and create networks of doctors who accept their pricing plans. And there are thousands of insurers with different coverage plans and payment arrangements, most of which are never shared with you and other payers. Dr. Rice says we have options. The federal government could offer a competing plan at a lower cost. It's called a public option.
What a public option means is that people not only can choose among private insurers, they can also choose a government option that would compete against the privates. We're not getting rid of private insurers, we're just letting them compete against a government plan. President Biden, during the campaign, said he wanted a public option. It's never been on the radar screen since he's become president. And the reason is that there would be so much opposition among insurers, among hospital organizations, among physicians, among pharmaceutical companies, that it's almost not worthwhile bringing it up.
Lowering prices would help Americans find more care. With prices cut, we could make more doctor visits or afford out-of-network specialists. We wouldn't have to choose between our health and our rent. Rice says selling a single-payer system to Americans gets tricky when they find out their taxes would go up. But he says even with more taxes, we'd still have more money left over because we'd make more to begin with.
The way it would save money is that employers would no longer have to pay for health insurance. And if you believe the economists, that would be passed on to people in higher wages. And that's a subtlety that either people don't get or that people get but they don't believe. They don't believe if their employer saved money by not purchasing health insurance that they would pass it on in wages.
Every one of us relies on the healthcare system. At some point, we'll all need it. But we also don't want to drain our savings paying for procedures that cost people in other countries a fraction of what we pay. Maybe instead of asking politely for lower prices, we could start holding someone accountable. That's how elections work. So who do you trust with your health? The corporate executive who needs your money, or the politician who needs your vote?